Oh, there we go.
Yeah.
Perfect. Okay, so I'm Mr. Soderback, by the way, for the students in here. If you don't know me already, I'm the director of the College and Career Center here at Vista High School. And today we have Adela Sanchez, and she is a nurse over at Tri-City Medical Center. And she's going to talk about nursing as a career today and tell us how she got into nursing. And then also what pathway you need to take to get to where she is today. So I will let her take it away. And everyone, just if you have a question, just throw it in the chat and we will get to that.
All right, good morning, everyone, and thank you for coming. Thank you for the introduction. Yes, I'm Adela Irma Sanchez. I am a registered nurse, and I am currently Tri-City Hospital Board of Director for Division 1. So I'm here today, like you said, to share my path, tell you how I got here, how you can get here if that's what you're interested in doing, and much, much more as a registered nurse. So first about me, I was actually born at Tri-City Hospital just a few years ago. I grew up in Oceanside, California, and I've now been living in Vista for a little over 12 years. I live with my 3 kids and my husband. We all have really learned to love Vista. My kids have lived here their whole life now. They all attend Vista Unified School District just like you do. They actually are all also high schoolers like you do, all 3 of them. I have a sophomore, junior, and a senior, and we love it here. So my education, I think I took the long path to nursing, but you know, that's what I really can emphasize with you today is there's no wrong way to get to the nursing career, and you just have to find the path that's right for you. When I first graduated high school, I went straight to Palomar College. I knew that I wanted to do something else. I could just never make up my mind exactly what I wanted to do. So I went to Palomar College and I ended up getting an associate in liberal arts and science. Then I got kind of persuaded and working. So I started working, I got promoted, and I thought I was making big money at my job at that time. But as I started to grow my family, you know, you realize that what big money is and what I was doing wasn't making it. And I knew that I had to go back to school. At that time, my mother-in-law was actually very interested in being a nurse, and she persuaded me to go back to school and try the nursing career. So what I did first is I actually took a class, the course to be a CNA, so certified nurse assistant. And I really encourage any of you that aren't sure or want to start something to get yourself into the hospital or into the medical career. I think you guys have a program there in ROTC where you can do medical assistant. Those are great pathways because it can get you into a healthcare field and it can get you into a position and help you to further your career later on. Once you're in an institution and you can show them that you're a good worker and that you have good work ethics, that you try hard, you're open to learning, then they'll really work with you and help you grow you into wherever it is that you want to be and move up in the ladder in the medical field. So if you think you want to be a nurse, a nurse practitioner, a physician's assistant, any of those things, I encourage you to try those other jobs that are, you know, the careers that are easier to do, and then you can move yourself around and see what you like. So I did that at Palomar College, and then I kept working. And then, like I said, when I found out, oh, this isn't enough for me, I went back to school. And then that's when I went to Maricosta College. And at Maricosta College, I got my pre-nursing education. So I went and got mostly all the sciences that you need for the nursing field. And I could say that I loved Palomar and I loved Maricosta. So either one of those, if that's something that you want to try, I think they both have great nursing programs. So once I finished Maricosta College, then I applied to a few different nursing schools. Like I said, I did have my family at that time. I had my 3 kids already. So National University was one of my top choices because they had an accelerated program. So while it was a little bit more challenging because you don't have any breaks and all the classes are condensed in 1 to 2 months, it was the best it was the best option for me because I was able to get it done a little more quickly. So I can tell you that there were a lot of days I woke up, or nights actually, that I woke up in the middle of the night because I'd fallen asleep on my textbook, but it just kept at it, and kept studying and didn't let anybody deter me. Don't I can tell you the same thing. Don't let anybody ever tell you that this is not the right path for you, or that you can't do something, because you can. All of us can find our own path, the right way, the right school to get where we want to be. And that's what I did at National University. I finished. So at about the time, a little bit before I started National University with, I had done that CNA course and I got a job in the hospital, not as a nurse assistant, but as a unit secretary. They took that as some medical terminology that I had. So I started working as a unit secretary in a what they call an LDRP. So it's kind of like they have labor and delivery, and they also have postpartum. So it's a smaller unit, but kind of everything is in there. That's at Scripps and Encinitas is where I started. And so while I was going to school, I was also working because I had my kids. So again, I talk about my long path, but I'm so happy that the way that I did things and for what I chose. So when I got to finishing National University, the accelerated program, like I said, you go a month, all courses are like a month or two, so it's full time. Sometimes you have your class and then you'll do your clinicals in the evening, or you have your clinicals in the morning and then you do class in the afternoon. Or you could have clinicals on the weekend. So it's just a full-time program. But again, it was such a good option because I was able to kind of manage that in a shorter amount of time with my kids. So while I was working, I was going to school, and then it worked out really well for me because once I finished nursing school, the unit that I was working on actually took me and trained me on the job. So at the time that I graduated nursing school, there weren't a lot of open nursing positions. The hospitals were kind of stable. They weren't didn't have a big budget for hiring, but I had established that relationship with the unit that I worked with, and they knew that I was somebody that they could count on, that I was willing to learn more, and that I was going to be a positive person in their workplace. And they hired me as a registered nurse and trained me on the job. So one of the nurses there just took me on as a new grad, and I got like a personalized program there and got trained into the postpartum unit. And so taking care of moms and babies when they're first born, so mom after delivery and newborn babies. And I just loved it. It couldn't have been happier there. And I was so grateful that they trained me, and it was really good to be into women's health. So I did some postpartum. There we go. So then that's how it started my hospital career. There's me in a couple different workplaces. Working at, you could see me with the newborn warmer. You can see me in the recovery room, see me with some of my other nurse friends, see us with some of our PPE on. There's me in the nursery. I think we were doing a training day in the very bottom. But so I've done some postpartum, that's taking care of, like I said, the moms and the babies. And then I moved to labor and delivery. So it's actually where we got to be with moms while they come in labor. And then I've done everything in kind of the women's health spectrum. So I did some triage, meaning like when they come in and think they may be in labor or have any sort of problems, I can triage them, see what's going on. And that's really fun. I really enjoy triage because you get to really do some one-on-one nursing with moms or laboring women or whatever their needs are. And then you report everything back to the physician and you help to make a plan. So I really like the autonomy of that and being able to work with a multidisciplinary plan team. And then I've also done some antepartum. So that means if pregnant women experiences any complications while she's pregnant, then she may come to the hospital to be cared for whatever it is, whether it be early labor that you're trying to stop, whether it be like a regular healthcare complication such as high blood pressure, kidney stones, anything you can think of, diabetes, any other regular medical problems, then they could be in our care for however amount of time. Sometimes it can be weeks until delivery. Sometimes it's days if it's a more simple infection or something that we can fix. And then, of course, the labor and delivery, which is just so fun because that's just helping a mom during her laboring process. So there's all sorts of different plans that women have when they're in labor. So you get to do all those sorts of things, whether it's holding their hand and helping them breathe through contractions or trying different moves to be more comfortable, getting an epidural, whatever it is that you do with them, and even push with them all the way up until delivery when it's time to call the doctor. It's a really great field, and it's really rewarding to be able to work with women and the whole family really in such an important time of their lives. And then I'm also, as part of the labor and delivery team, you can also, there are sometimes when women have to have C-sections. So I could be a pre-op nurse. I could prep them and get them all start ready to go into the operating room. Could also go into the operating with someone, a pregnant woman, and then that's when you're called a circulating or OR nurse. So in there, you help to prep them for a sterile delivery. So you make sure that everything is nice and clean, and you have lots of different jobs. And then there, you're working with an even bigger healthcare team. You have your physician, your physician's assistant, an operating room tech, and then you have the anesthesiologist, yourself, and a baby nurse. So that's really fun too. So labor and delivery has been also great for that reason. You get to try a little bit of everything of nursing because there's so much to do with them. And then after the OR, you become a PACU nurse. That's a post-anesthesia care unit. So you help them make sure that they recover safely from the anesthesia medication that is given to them. So you make sure all their vital signs are stable, that their bleeding is normal, and it's also a really fun job. So also as part of my hospital experience, I've been able to work I worked at a PACU at Sharp Mary Birch. So if you guys, they specialized women's care hospital in San Diego. So in that PACU, you do all sorts of, you see all sorts of women's surgery cases. So they may have a surgery for a regular C-section like I've done before, but they could also have anything else. So anything women's that you may think of. So if they have to have a hysterectomy, a tubal ligation, maybe they had some cancer, or they could have had a plastic surgery that they went through. And I do all of those. I do recovery for all of those women. So you may have them for a few hours, and then you can send them possibly to another unit on the hospital, or they get to go home. So that's super fun. It's a little more fast paced, but you get to talk to so many people and see so many different types of cases that I really have enjoyed that time too. And then also, while I was at National University, I got my public health certification. So I've been able to do some home health as well. So I've been taking care of a disabled child, and that was really fun too. It's a totally different setting outside of the hospital. And most recently, I've also been a school nurse. So just being a nurse is so rewarding. There's so many different things that you can do. Being at the bedside and working with so many people, I saw what it was really like to be a human. And I know a lot of people are attracted for nursing for this reason, but you really are able to help your community and the people around you during their most vulnerable times. And it's one of the most rewarding things I've ever done in my life. And I just really love that you can do so many different things. So with that, being in the hospital, that's what led me to run for Tri-City Board of Directors. So I learned a lot new things running for the Tri-City Board. One of the things that I was able to do is run for the board of director. And what I found out, so working for the hospital as a bedside nurse, I saw a lot of things that I really enjoyed and really working with patients, but I also wanted to be able to make some of the decisions that affected the frontline workers, that affected my community patients. And so I found when I heard that the Tri-City was open for a new board member in the district that I lived in, I decided to do a little more politics with my nursing license. So as a nurse, I felt like I was a lifelong volunteer, and I could be an advocate for my North County community, for the people that I know, that I love, that I've grown up with, that I felt like needed a voice from a frontline worker to say to the big management team and to the head of the hospital that this is the direction that we want. These are the things that the frontline workers need. This is what our community is missing. So running for Tri-City Board, I did not know it was going to be such a big, it was more of a political position. So I actually was on the November ballot. I had to do a little bit of campaigning. So I got out there, I was talking to people I had to talk to people about myself. You can see from that previous picture, I got supporters to help me stand on corners, twirl signs, and I had to make brochures. And this year, being that it was COVID, we couldn't do the typical things like going and talking to people at their homes, but we could leave brochures and flyers about myself so that people could learn about me. I talked to some of the local unions, got a little bit of political party support so that people could get my name, hear my name, and see me out there and see that I was a registered nurse who had actually worked at Tri-City, who was a frontline worker, and I understood the needs of our community and my coworkers. So it was really hard work actually to really get out there and try to see as many people as you can in the community. But again, I was just so happy that as a registered nurse, it was just one of the things that you could do. So on top of all the other hospital bedside things I've done, now I can go to meetings with other managers and community members and try to voice my support for what I know, being a registered nurse and working right there in the trenches with all my other coworkers, and not just nurses, but physicians and support staff such as your clerical, your techs, and your respiratory therapist, all of those people that are looking to our managerial team to help us go in the right direction. So I was able to do that as a registered nurse, and I think that our community felt that a registered nurse does know those things, has been there, and can help us move forward with our community hospital here, Tri-City, to get some good things happening. And they have, and Tri-City's trying harder, and they have a great team now that's really working to get out into the community and show people that we want to do the right thing. So this year, my swearing in was online. It was in a Zoom meeting, just like we're doing today. So like we're learning all of these things that we're doing differently. It was a swearing in ceremony there that I did, and it was definitely different swearing in on Zoom, but nonetheless, I was happy to do that. And the other picture of me, that's a picture of me and my at Tri-City, and where I got recently was just able to get my COVID vaccine. So I was happy to do that so I can bring our community a little safer. So as a Tri-City Healthcare Board of Director, all of the meetings are still on Zoom, but you have monthly meetings that you're able to go to. And the managerial team, so including the CEO and some human resources and their CFO, they present everything that they're doing to you, and they send you things for approval. It's also our job to kind of get onto the community, to be representatives for Tri-City, to really let people know the things that we're trying to do, and to listen to our community and hopefully meet the right needs so that we can make sure our community hospital is serving everyone the way they're supposed to be. Then we start some other meetings. So there you become chair and members of other community groups. So they've formed, for instance, a healthcare alliance group. They have a community outreach group. They have a finance group. So I'm just starting those up. So going to be members of those. So hopefully we can start doing even more things out there in the community and share what Tri-City is trying to do and hoping to accomplish. So like I said, being a nurse is just so rewarding. There's, all these paths that have been able to try and I can take, and things that I'm doing now that I love. And, being a nurse has been opened up so many different pathways, and there's not one right way to get to being a registered nurse. And once you're a registered nurse, there's all sorts of things and all sorts of pathways that you can do. Registered nurses have roles in everything in the community, every job, everything. I've, volunteering at your Girl Scout camp or being the school nurse or working in the ICU or the PACU, all of those things. And now even for me becoming a Tri-City Healthcare Board of Director, it's just such a great job, and so many things that are that I'm able to do and that I'm able to do for the community. And I love it. So I'm so happy that you guys were here to listen to me today. We can take some questions and anything else that comes up, any other questions you have. I'm happy for Vista to share my information with you so that we can talk again, or if you need some advice or something, I'm happy to do that for everyone, because I want as many of you as possible to be nurses. It's important that we have our community represented and that we can all move forward and do our part.
I think, if you want to put your questions in the chat, you can do that and I can read them out, or you can just come off the mic and ask a question. So I do have one question right off the top.
Yes.
And that is, to become a nurse in high school, what should I be taking? We don't really have an established like pre-nursing course and things like that, but what are some things you need to master at maybe the high school level to help prepare you for like a nursing education?
I think any healthcare classes that you could get are great, but also some of the sciences. So getting a little, your biology. I don't know how far you guys go there, but they do have like the physiology and some chemistry. So those pre-nursing, the science classes are what you have to do before you can graduate. So some of those are great. Also, I would really encourage everyone to try to go for a BSN program. A lot of places now are only taking baccalaureate students. So if you can try to go that way. Although if you started ADN and then moved up, that's fine too.
We have a question in the chat, which is, how did you know what to take in college?
So they actually are very specific about your nursing, about the prerequisites that you have. So I would pick a school. You can pick anyone and just go with the regular nursing. But once you get into community college, they're really good. The counselors there are really good with the nursing field. So they'll tell you what to do. But if you started with the associates, I would do like an associates in the sciences, because they'll make you do all of those for nursing. But all of the programs, if you look them up anywhere, they'll tell you exactly what courses you need and where you need to, and then what will happen in nursing. So once you get into a program, then they tell you this. It's not even like you sign up. They sign you up, and they'll tell you it all goes in order. Like you'll start with med surg and then move up into other courses. So you don't have to worry about once you get into the program. And just prerequisite, I would pick whatever school, and then you can see what they want you to have before you went in. So I spent a lot of time talking to the counselor, going in and asking them what do they need and getting help to navigate. I feel like in high school you have all your counselors, but you kind of know what you want. But when you go to college, really make yourself known to the counselor and get advice from them, because especially with something like nursing, they're used to it. They know they can pull out 2 little sheets probably in their back pocket and tell you exactly what you need, because it's such a popular field and they need more and more nurses all the time. So it's such a good thing to have. But just go in there and don't be afraid to ask.
Yeah, I think one thing to keep in mind is that um, the nursing schools that have a fixed capacity. So even when there's a high demand there, you may have to wait, take your prerequisites, and then apply to get into those programs. So for typically like Palomar, you're not going to be entering in your nursing education immediately. You're going to be taking the prerequisite courses first, and then you kind of have to qualify depending upon like a point system to get into that program. While we need a lot of nurses, it's also very popular. So there is some competition there as well, or you have to wait longer.
Yeah, and with that, go see the counselor early so you can meet the minimum qualifications right away. And then you can apply and keep doing those extra courses that you also need, but won't necessarily stop you from getting into the program. Because some of the nursing programs will take you, like if you're in progress or almost done. So that's where you can see the counselor. Do you agree, Mr. Soderback, and see and kind of get in as soon as possible? That way, like he said, if you don't make that next class, they may say you're the third cohort, which means like 3 more semesters, but you won't be held back by that. You can continue to do those ones that are allowed to be in progress. So definitely see the counselor right away so you know that you're taking the right courses at the right time to get in as quickly as possible or meet those qualifications to even apply.
Yeah, and part of that process is they're going to be looking for things that you've done besides coursework. There are some good internship programs in San Diego area. And there's also, you can do volunteer work as well. And I know Tri-City has a huge volunteer program. And that helps get you into the environment and also looks good in when you want to apply to get into the nursing schools. Okay. Any other questions? Because if you guys don't ask them, I'm going to ask them.
I have a comment.
Yes.
So
Yes.
oh, sorry, I muted myself. I was just saying, thank you so much for being here and for explaining your journey. I think you were saying how, you took the long route, but I think that's so cool because, life just unfolds and, you don't know what you know. And you took long
Yeah, I think you're
and opportunities.
breaking up there.
I also wanted to know, can you hear me?
Yeah, you're okay now.
Yeah, we can.
Okay. So I just wanted to know if you could do it all over again, what's something that you would tell your younger self?
Don't be enticed by what you think is big money at that mall job, because that's what I was doing. And while I was able to become a manager at the little jewelry kiosk in the mall, it really distracted me from continuing school. And when you get into that community college, I feel like you have a lot more lax and you're still at home, so you feel comfortable, but don't get comfortable. Remember to keep pushing forward. And that with college, it really does open your door to more experiences and more opportunities. So while it was perfectly fine for me to go that way, I wish I would have pushed forward just to make life a little bit easier for myself.
Thank you. Also, I'm super excited for you to be on the board. I think that's so cool to use your voice and your power to, stand up for nurses and, other disenfranchised people. So awesome. Thank you.
Thank you. I'm trying.
So a question a lot of our students have is they have no idea what anybody gets paid or, what it's like to do that. I guess first thing for hour wise, obviously nurses don't work like 9 to 5 type of thing. What kind of is like a normal shift schedule for the week? And then we'll talk a little bit about compensation.
Yeah. So when you're in the hospital, it's 12-hour shifts. So they're normally I would say 90% of the hospital is on a 7 to 7. So you go 7 a.m. to 7:30 p.m. or 7 p.m. to 7:30 a.m. You can expect as a new nurse that you're probably going to be that night shift. You're probably going to be that 7 p.m. to 7 a.m. You'll either love it or you'll hate it. I've done night shift the last 15 years and I love it. I've had lots of opportunities to go to day shift and I've never wanted to. So, you'll just have to see where it is, but you can expect to work at night for a few years. The good thing is it's that 12 hours. So 3 night shifts or day shifts, if that happens, but 3 shifts are considered full time. So it's 36 hours and you do meet full time. So you get full benefits, insurance, medical insurance, life insurance, 401, all of those things are pretty much all the hospital jobs. So you do get that. And then and then there's always lots of opportunity. Most nurses, I would say, make more money on overtime. So then if you worked an extra shift, which hospital life, almost all available all the time, just depending on what field you're in.
And what would you say that just on average, an average RN makes once you're past that first couple of years?
Yeah, I would say between 60 and 80,000. So you're looking at, you're looking at probably, I think most of them start now at like probably between $50 and $60 an hour. And then you have differential. So for working nights, most places it's like a $4 to $5 added pay for you to work at nights. Some places will also have a weekend differential where it's also a little extra to work on the weekend, but it's probably not as common anymore, but every once in a while you'll have that. And then if you worked over 12 hours, so sometimes it's like really crazy night or day and they need you to stay longer, that's automatically double time. And then if you come in extra, your time and a half. So a lot of people I would say hospital nurses can make more like 70 to 100,000 working overtime. But then some people will argue get too much taxes taken out. But you do have all of those opportunities in the hospital job. So that's what's nice about it. You kind of have the opportunity to make more if you want to.
I have a question.
Yes.
Well, William, I'm going to have to cut you off. Unfortunately, we need to end our session here because our time is up. But William, you can certainly send me questions and I can pass that on to Ms. Sanchez. And Ms. Sanchez, thank you for coming today. It's been a great insight into your career and thank goodness you're on the board, but we certainly have high hopes there. And hopefully we'll have you back again sometime in the future. And for everybody who joined in today, thank you very much for being here. Unfortunately, we do need to get to our next section. So thanks everyone for being here and thank you so much for taking time with our students today.
Thank you, Mr. Soderbeck, and feel free to share my Tri-City email. Anybody has questions.
Thank you so much.
Thank you all. Bye-bye.
Thank you.